Welcome to today's noon seminar. The seminar was organized today. I'm very grateful to my colleague Norma Ibarra, who recruited today's speaker to come present to us. She will be a couple of minutes late, so she says she will arrive soon. So thank you for joining. Thank you for joining online. Hopefully you can hear us well. If not, give us a bit of a signal. Our speaker today is Dr. Diego Herrera from the Research Institute of the MUHC, where I want to get his title correct. Yes, he's actually our Equity, Diversity, and Inclusion Specialist at the RI, so he plays an important role in supporting research and supporting practices and supporting labs and PIs, and I'm sure the executives as well, hopefully. Diego has a PhD in intercultural communication and development from the University of Montreal, so he comes very well equipped to discuss these topics, and he's got years of experience in working with a number of marginalized groups, a variety of marginalized groups, such as women, LGBTQ, victims of war, and Indigenous peoples. And today, we're going to hear from Diego on the topic of inclusivity in research and his journey from lived experience to institutional practice. Welcome.
Thank you. Thank you very much for the invitation. It's a pleasure for me to be here. Thank you to Norma and to Eve for their kind invitation. So today, this won't be like a clinical talk. This won't be related to cancer, but I tried to walk with you through my personal history to tell you how I see inclusivity, to tell you
au step 2, chambre 28. Attention, code blue battle, block C, Charlie, level 7, south, room 20.
I just want to make sure that we see your screen, actually. Are we sharing? I just want to make sure that we are share PowerPoint. Okay. Well, see, another interruption. Might as well do that.
Attention.
Okay, now we see your screen. And you'll be able to start seeing.
C'est Charlie 7S, chambre 28. Attention, code adult, block C, Charlie 7S. Room
This one
28.
we can probably minimize by doing that.
Okay, perfect.
Excellent.
Okay, after the code bleu, we can start. So what I was saying is that I will try to walk you through my personal experience that led me to work in equity, diversity, and inclusion, and how I try to apply this in the work we do at the Research Institute and how this is connected to the work of research that we do. First of all, I'd like to start with this question: why inclusivity in research? Why do you think inclusivity is important in the research work we do? Is anyone willing to share any idea of why this is important? Why do we care about this notion? Yeah, Abe?
To bring many perspectives.
Bring many perspectives, yeah. Or ideas. Online, maybe.
We limit biases as well.
We can limit biases, we can give everyone or every kind of knowledge the same value in the kind of work we do. Yeah, so it's related to that, and I'm going to go more in depth throughout my presentation. So let's start by trying to see how many squares can you find in this image below.
I can't count them. 16.
16. Yeah.
More than
More than
36.
Sorry?
36.
36.
I don't know.
All the combinations.
Yeah.
I got 23.
23. Good. So honestly, I've seen like 28, but they say it's 32. I haven't
Me too.
It's 32, but it's very hard. Anyways, but there's no, I mean, everything depends on how we saw it, the time we take, how familiar we are with, and so on. Also, we have this image here of these two subjects discussing, they are talking about a 9 or a 6, right? It depends on, for him, for sure, this is a 9. For him, he's completely sure it's a 6. So all this to say that our gaze is important, our viewpoint is important, where we are situated is critical. There's no neutral knowledge. All the knowledge that we produce is situated, is located in something, and this something is our social groups, our social fabric, our personal history, where we are, and all knowledge, when we are talking, when we forget that knowledge is situated, it's because we are hiding who we are, it's because we are participating in even unconsciously in relations of power that can provoke or exclude other forms of knowledge. So from feminist activists, we learned that knowledge is always situated, partial, locatable, critical, and can be connected to other forms of knowledge. So the very first thing that we need to do when we talk about inclusivity, bringing different perspectives, assessing how biased we are regarding some forms of knowledge, looking at who will listen within our research is, where am I situated? Where's my gaze? Where am I and how am I affected by my own life, right? And how this position is leading me to give a hierarchy to some positions or to discard other forms of knowledge, right? There's no neutrality in the work we do, even if we are told that we need to be objective, that we need to be aseptic. There's no such a thing as neutral science. All our science is a social construction, right? So because of all this, our science has been traditionally exclusionary. Even if Black people are the most affected by cancer death, their enrollment in clinical trials is only 4 to 6%, even if they represent more than 15% of our population, right? Same thing with different minority groups. These are data from the US, but they're only present in are only present in 8% of trials, Asian in 6% of trials, Hispanic in 11%, while their actual proportion in population, in the private population in the US is still much higher. So we are not, our science is not showing the reality of what's happening with our communities. Why? Because we are still focused on our supposed neutrality, and we are not listening to the people who are facing difficulties outside. And there are other elements here, like many drugs were withdrawn, for instance, because they pose greater health risks for women than for men, while this risk could have been identified if we had more tests with male and female subjects, just because our science has privileged the use of male subjects because it's easier to work with them. So all of this to say that our presence in science has been currently exclusionary because we haven't raised the question, we haven't wondered, okay, where am I situated? Am I situated in a position that isn't exploratory people? Am I situated in a position of privilege where I'm unable to see, to listen to other realities? How can I get out from this position in order to enrich the science I do with other visions, with other realities, with other forms of knowledge and other solutions that can enhance the science we do? So I will go through my own gaze and then let's see how this leads us to equity, diversity, and inclusion in research. So I grew up in Medellin in Colombia in the 1980s. This is what we saw every day on our newspapers. Imagine, I remember the image of my professor of second grade on the door of the school saying, stay there because a new bomb is coming now, and I'll tell you when you can get out, when you can rise and get out, or I will call your parents because it's not safe to get out from school right now. And it didn't happen once, it didn't happen only to me, it happened to my mom as well, who was professor. We're not directly affected as a family by all this violence, but all our neighbors were affected. Many people were killed, many people lost properties, things like that, for as a war that we didn't know what it was about. A war that was we didn't know what was happening. We didn't own this, but we had to live in the fear that any car that was parked, we thought, okay, this is a car bomb, a bomb car. This will explode somehow. We needed to run, we needed to learn to survive. So my very first question, since when I was really a child, like let's say 8, 9 years old, was why violence? Why are we so violent? Where does all this come from? And I grew up and and started saying, okay, I need science, I need research, I need methods to understand why all this violence happens, where all this comes from. And I started studying in communication, working in journalism, and saying, okay, I need to understand, I need social science methods to understand the causes of this, but I also need to communicate that in a clear way to people to produce emotions, to produce social transformations. And in the 2000s, I started working with um, people who were victims of the conflict of Colombia. So we were victims of the drug dealers and the guerrillas who entered in our communities, in the cities, and the only thing people had to do was resist and survive. And what I started analyzing was the practices of resilience of these people who were there to resist and survive and to create new things. This is a pathway, this is the quality of the pathways they had. So it was a place of exclusion, and something that I learned from this process where I conducted a lot of interviews, participatory observation, and so on, is that these women are always trying to connect young people. We're always trying to transform their neighborhood, even in the middle of conflict. We're always trying to become agents of development in the middle of all this fear and violence. And men were invisible or were taking credit, for the work that women were doing. And that for me was a shocking experience. I remember my professor of research methodology, he said to me, your data is revealing the importance of women in changing the reality of this marginalized neighborhood. You need to adopt a feminist perspective. Like, I'm not a feminist. Why should I draw one? This approach that is for women, that is all women, is that you don't have any choice. Your reality, your data is showing you that. And since that moment, the reality converted me to feminist because I don't have any other choice. Like, it's women who were living. It was women who were transforming, who were connecting people, creating networks, creating organizations in the midst of this violence and creating some hope within this places. Currently, the place where this is the shape of the neighborhood so far. And if you go today, and I started doing like participatory projects with them, supporting the organizations that were leading all this social work within these communities affected by war. And currently, this is the shape that this place has. They were able, through many projects, all the time, through many connections, even some connections facilitated by my research project, to connect with the main authorities and so on. And currently, if you go to Medellin, you can see Comuna 13 as one of the main touristic attractions, you know? So one of the main concerns was how to transport people from one place to another through these paths, you know, through these stairs that are on very big slopes and so on. And now they have escalators to move on public spaces and so on. So all this violence, all this situation, you know, and motivated people to resist, to be creative, and finally get out from their conditions. And something that I learned at this point is that solutions need to come from people. We need to build solutions from people's ideas according to the specific materials, according to the specific needs they have. And through this specific interventions in infrastructure and so on, that was an important social change in terms of less violence, more connection, less fear, and for sure there were other factors that helped to all that. And another important element that I learned from this process is that social actors deserve to be heard and recognized. And our research projects can become an act of recognition, can become an act of representation of all the good ideas, of all the contributions that they have to provide solutions. So that was from 2025, 2026. Then I said, you know, when you study conflict, when you've lived in conflict and so on, you start saying, oh, this is too hard, it's too heavy, you're reading about this, you're reading about, you know, bombs, attacks, and so on. So I started looking for other, like, more peaceful places. And one friend of mine invited me to the Amazon, and I said, why not? It sounds like the lost paradise in the middle of the forest and so on. Big surprise. I arrived there. It's very beautiful. I invited everyone to happen to go. The Colombian Amazon is one of the less intervened areas of the Amazonian forest. But my big surprise was when I started it with my research participants. All of them said, yeah, I was displaced by war in 1940, I was displaced by war in 1980s. My family was killed there and so on. So all of them were affected by other forms of conflict. It was unbelievable to see how the conflict was so complex that finally everyone was affected, even in the most marginalized places of the region. And I arrived there as a foreigner, you know, that because I came from Medellin, which is in the Andes, yeah, which was the 1,000 kilometers far from the Amazon. I didn't have any idea of the region. They have other languages because they're indigenous people and so on. So I started creating a connection and so on. I worked with them for one university, University of Mass, for since 28 to 2012. Then it came 28 to 2011. Then I came to do my PhD here, and I went back to the field work, and I had everything written perfectly in my thesis proposal about participatory development in the Amazon and how to try to show their resilience and their abilities to transform their marginalized situations. And the very first thing they said to me is, what is this research for? Like, what's your plan with this? I said, this is good for theories of development and social change. This is going to be good to showcase what you do with an impact. Many people have come here to do the same and so on. We don't need that. Imagine I was really anxious for one moment in the middle of the Amazon trying to negotiate with different indigenous leaders and to explain them that my project was important. But I had made one mistake. The project was important to me, not to them. The only moment when everything changed was when one leader said to me, are you a lawyer? Well, no, at all. And he said, we have one project now. We need to formulate one proposal to the government for the recognition of human rights of indigenous displaced people. Can you help us with that? That can bring, we need to create an opportunity for the recognition of the rights of indigenous people to better healthcare, to the access to lab, to consolidate our presence in this territory, and to political participation according to our union. Oh, this is, I can be very useful if I work on this, but this will entail a lot of changes in my places and so on. And he says, yes, I will work with you. So my theoretical framework and methodologies that were more on development and so on changed, and I started working on a completely different field, which is human rights, international law, international law, violations of law, and so on. All this to say that only by adapting myself to people's needs, I was able to complete my fieldwork, to do my research, and finally to create a relationship of trust with the community. Okay, so the very first question was, how is this beneficial for us? And our knowledge is valuable, right? And I changed my subject, so all these people started being open to my presence because they saw me as someone who was working for this specific process. It was it was a legal act on the recognition of the rights of indigenous displaced people. It was called the Auto Ceremony, so they called me the guy from the Auto. So I started creating a trust relationship with them, which allowed me to go into their spaces, to their ceremonies, to their discussions about how they imagine their own territory, what are the projects that can be beneficial for the entire community. I started working through very participatory processes to listen to them and then to integrate all these in the proposals that they were going to present to the government and so on. And all this allowed me to do a thesis on the intercultural tensions between the government visions of rights and indigenous visions of grounded in even spiritual knowledge grounded in ancestral territorial knowledge grounded in their own history. So from that, I adopted this approach, which is the approach of decolonizing research.
If you can stay closer to the microphone.
Okay, good. Thank you.
Thank you.
Yeah, so from that, I started adopting this approach on decolonizing research, okay? There are many visions of decolonizing research, but there's an important pioneer, which is Linda T. Hawaii Smith, who's a Maori person from New Zealand, and she raises critical questions. Whose research is this? Who owns it? Whose interest does it serve? Who will benefit from it? Who has designed its questions and framed its scope? Who will carry it out? Who will write it up? How will its results be disseminated? So I think this is very important for the work we do, because something that happens many times is that we think of our own interests. How will I be recognized in my field? How will I discover this big thing? How will I become the most creative researcher and so on? But is really your project connected to the realities of your patients? Are you recognizing how they are located in a specific social group, in a social class, in their linguistic differences? What is the role of their beliefs in the treatments that you are creating, right? You're not working with machines or for machines, and your field is not neutral. That's how I started. You are situated and they are situated as well. So try to establish a relationship of trust, a relationship of reciprocity. So to me, that was a critical point in which I learned a lot. What Linda T. White Smith says, research is a humbling and humble activity. We are servers of our communities. We are not there to shine and to be cited. We are there to serve to the needs of people, and we are there, and we must adapt ourselves to their needs. So this was critical in my process. How does this research benefit Indigenous people? How does this take into account their understanding of respect? Because people understand respect in a different ways in the Middle Amazon and here in Canada. Indigenous people have an understanding of that regarding other non-Indigenous people. So it helped me redefine research at the service of communities, not the opposite, humbling activities. Focus on reciprocity. The work we do is important that we do with them. Okay, how we can do all this work with them, how we listen to the people, how we listen to the different actors, the knowledge users, the patients, the caregivers. They take the critical role because they are the ones who ensure there's adherence to the treatments, and not on people. We're not working on you, we're working with you. We become partners in this process. Another important element is that since we are in academia, we believe that, okay, we know we are part of this club and we can cite a lot of authors, our knowledge has been validated and so on. But people outside academia have a lot of important knowledge as well. They have knowledge that they've learned through the pain they've lived. So these Indigenous people have had all the pain of displacement, being expelled from their lands, all the cultural genocide that they've lived in Latin America and even here in Canada and so on. Your patients as well learn through their pain, learn through their processes, learn through the anxiety to come to a hospital to look for a treatment and so on. So how can we put at the same level their knowledge from their experience with our knowledge that comes from science? And that's where the two-eyed side approach that Indigenous people teach us is so critical, how we can complement, and there's no rivalry between these two forms of knowledge, there's complementarity between them. Research needs to be connected to emancipation. Okay, that's what I learned from my work in the Amazon. These people wanted to be recognized as Indigenous people. These people needed to be recognized as different, as culturally different, but with rights to clean water, to health, to proper healthcare, to political participation, but in their own terms, and to dignity. I put here some images of other works that I've done in many other countries through my work in international cooperation. This is the work with some Indigenous people in Nepal, some activists in Haiti, some Indigenous victims of violence in Guatemala. And I remember one Sunday afternoon at, let's say, 4 p.m., in a rural place of Haiti near the Caribbean, okay, the Caribbean Sea. I was not on the beach. I was in a meeting with women, leaders, and I said, who wants to meet on a Sunday afternoon with all this humidity and, some meters away from the sea and so on? I went to visit them. I was planning a project that was going to be funded by the government of Canada. The project was called The Voices and Leadership of Women for the Empowerment of Leaders and the Recognition of Rights. And I arrived, and the room was full of leaders. They were eager to participate. And they said one central thing. They said, we need research because we need data on our situation to transform our reality. to me, that was really shocking because research is a social need. People are eager to know more about their own realities and how to transform them. And they are eager to be heard. And we have the methods. We have the methods. We have the facilities. We have the infrastructure. So it's up to us to put it at their service. So research shouldn't never be disconnected from the people's reality. Okay. And then all these finally led me to work in equity, diversity, and inclusion. So what you're seeing here is like my first colleagues when I started working in this field in 2020 at the University of Ottawa. And then I moved to work here at the RI on this topic. At the RI, so I bring all this baggage to the RI. That's how I am situated to work in the research institute. And my mandate consists basically of making the research institute a place, first of all, where everyone feels valued, feels respected, and free from harassment, regardless of their background, origin, and so on. And also to facilitate the connection between the RI research and the marginalized populations. So we work internally and externally. That's basically the work we do. And we've been doing too many things. These are some pictures of things we've doing. For instance, we create tools to guide you in how to integrate these marginalized populations, guides to integrate people with disabilities in your research teams or in your research projects, how to address the needs of LGBTQ population as well. In 2 years ago, we supported the CIM, the Center for Innovation Medicine, in the transition of one of their employees, the gender transition of one of their employees. The person had difficulty in leading this gender transition, and we prepared the team because we said the problem is not in the person who is transitioning. The problem is in the group where she is situated. And now she continues to be a full-time employee. She continues to thrive, and she's now one of our main leaders of our affinity groups. We brought Indigenous perspectives at the RI, and we're trying to strengthen our partnerships with Indigenous groups. For instance, we created a strong partnership with the Cree Board of Health and Social Services of James Bay. Now we are trying to partner with the Ganawagi Education Center and the Ganawagi Diabetes Prevention Program. So, and with all that, we created a program for mentorship for Indigenous trainees. Now we are in the second year of this program. The last year, we were able to recruit 2 Indigenous trainees to offer them a paid internship for the summer. And in this summer, we're going to offer them again 2 paid internships to more candidates. So all of this to bring Indigenous perspectives in the work we do, because, you know, if we want to do excellence research, if we don't want to do excellent research, we need to bring the voices of these people who are facing obstacles, who live social determinants in a different way, and whose health is affected by all that. We created a program of internships for people with disabilities at the RI. Currently, we have 4 interns with disabilities, 1 blind person helping us reshape the program assistant pool. And we have wheelchair users as well, and we are adapting our infrastructure to their presence. We created a guide of inclusive writing, scholarship for racialized and racialized trainees, and we extended that to other equity-seeking groups. There are other activities that I have here. We try to improve representation of all the different groups, and as you can see, we've improved all the different numbers. The only place where we still have difficulties is with the recruitment of Indigenous people, despite all the efforts. But we need to continue in that area. For instance, in 2024, we started asking people at the RI, do you identify as a non-binary person? And the number of people self-identifying as non-binary duplicated in 2 years because they started feeling, this is important. There something could happen. Okay, so these are some of the programs that I was talking about: employment accessibility, support to racialized candidates who want to become researchers at the RI. We've been given that because we believe their experience, their voices are important. Established mechanisms to listen to EDI related complaints such as discrimination risks, harassment, and so on. We've improved our accessibility, created an accessibility plan with the MUHC. We are offering accommodations and salary support to hire people with disabilities through some specific partnerships with specialized organizations and created an affinity group. We've given training, created a MOOC tailored to the institutional context. I invite you all to consult that. If you have an RI address, it's called Let's Be Allies, where we present our reality and how to make our spaces more inclusive, how to make our methods more adapted. We led one summer school on inclusive research attended by 160 people. There's a cohort of 20 trainees to participate in person, and we opened some sessions to the public. And in that space, we talk about why inclusivity is important, how to adapt our methods, how to better listen to the people, what is intersectionality, to understand how power relations exist in the field. They determine the situations of the health conditions of our patients or participants and how we can transform all that. Created several institutional guides, the ones that I was mentioning, and it's important that you know when you appropriate all of them. We support researchers in integrating EDI in their research grants. This is an important area. Many times people see EDI as one sentence to add at the end of the proposal. And that's disappointing because when you include your population since the very beginning, when you think of other perspectives since the very beginning, when you ask the question, how would this be if I think it from a perspective different from mine? Okay, when you bring these other viewpoints, you change your object of knowledge, you change your methodology. So we try to help them in integrating EDI, and all this brings important recognition and sustainability to the RI. We produce some articles, we create a network of EDI specialists, participating in specialized publications, and we've been presenting our good practices to different institutions. This is our plan's goal, but before that, this is like one example, for instance, of things that we could do when we do science that is more inclusive. So this is an article that I will share with you all that is a good example on how to adapt ourselves to the realities. In a traditional approach, we can simply conduct literature review. This is a project on rehab methods for people who are at high risk of fracture. Okay, and they created a new postoperative orthopedic method. So the traditional approach would be inviting some patients to participate in experimental procedures and to validate some methods with the scientific community. If you see here, they're invited regardless of their ethnicity and social conditions. So you treat everyone equally, right? And then you validate, and then you disseminate results with the community. But if you take an inclusive approach, since the very beginning, your literature review is going to be different because you're going to read, okay, this topic was thought in other countries in a different way. this topic has been thought by female researchers in a different way, by people focused on aging in a different way. They created a study sample population reflecting the community affected. So that's very different from bringing patients regardless of their ethnicity. When you treat everyone the same way, you are creating disparity because people need people need adapted methods. People need us to recognize their condition and then to adapt to their reality. So they created a study sample population reflected the community affected. So they realized that disaggregating by age was important, disaggregating by ethnicity was important, disaggregating by language was important too. They created meetings according to gender, ethnic, and language differences because they realized that women were more shy when men were present. So to facilitate the conversations, they create specific groups for women, specific groups for men, specific groups for immigrants from India, others from Africa, and so on. This was led in the UK. And interestingly, they engaged a live illustrator to engage in community analysis and administration. So instead of only the researcher doing the analysis, him or herself, they were doing the analysis with them, facilitated by illustration. I'll show you in some seconds what they created. And the community constantly participated in refining methods. They said, this didn't work, this did. Another important element is that they tried to see what could be beneficial for their community. So they hired a physiotherapist and someone specialized in rehab to help them with some of their health problems during the research project. It was not part of the research project, but it was like an added benefit that they brought to the community. So again, try to think how your research can connect to these benefits for the community, and the results were produced while they were produced. This is the yeah. So this is the article I'm talking about, and
Sorry, just a small thing. I don't think that we share renounce because we were sharing only the public placement.
okay.
I'm not sure though.
Yeah, here it is. Let's see. I'll stop sharing and reshare. Yeah, I think you were right. Thank you. Yeah, so this is what they built together with the community, right? So her research working with us, research needs to come with us. The community is the expert using the icons of the community, the importance of building trust, regular visits, creating like a calendar where the presence of the research was important. It became like part of the daily life of the community. Arranged translation, created community groups by gender, by ethnicity, health issues, the services they provided, food, taking notes. This was like a summary, but the graphic designer was there to show how to appropriate these results, how to connect, and how to make all this process meaningful to the entire community. So going back to the presentation, and then I'll need to share again. And I'll finish with this. We now have like a new action plan, EDI action plan that draws on the results of the last 3 years action plan. And the first thing that we'll do is to create and maintain inclusive work climate, diversify recruitment. We'll focus on recognition and engagement. We'll create a certification called My Inclusive Team, okay? Where people from different teams can be your teams, right? Tell us what they've done to do to make their spaces more accessible, to make their work climate more inclusive, more open to different views and so on. And we want to disseminate, to show all that, to show what are the examples to emulate, okay? Strengthen EDI related skills. We'll create an internal community of practice where we'll bring experts and people can bring their questions and solutions in order to create solutions adapted to our specific realities here at the RI. Strengthen institutional culture of inclusivity. If we don't think of inclusivity as a cultural practice, as a cultural belief, it will be an empty, a buzzword, right? So the idea is how we build awareness dialogues, how we connect the different equity-seeking groups. That's what we've been doing, and we'll create a platform called the Voices of the Institute, a place where through videos, through podcasts, and so on, people share their insights on how they see inclusivity and how their research has improved through different methodologies, through listening to the people. And finally, we want to document and innovate on the organizational and research practices. And we're going to create a living playbook where we document case studies of what has worked, case studies that allow us to demystify what EDI is and the value it confers to research. So this is what I had to share with you all. I hope you enjoy it. I don't know if you have questions, comments, suggestions.
Yes, we do have time for questions. Thank you very much for interesting presentations and giving us your perspective and a perspective on the work you now do at the RI. I thought the concrete example of the article you showed of how to redefine research or like the approach was enlightening. So this is something that I think we can take back and hopefully apply. So thank you for that example, for making it concrete. The floor is open for questions. We're also open to questions online as well. Either speak up or place your questions in the chat. That was an earlier message, I think, of someone asking about the
Okay.
microphone. Questions in the room here?
Sure.
Julia.
I have a question that might be a bit of a curveball. A lot of us are not recruiting people for our research, right? A lot of us are doing research with phantoms, kind of with objects instead of people. And so I was curious if you had any suggestions. How does EDI come into play for that kind of research?
Yeah.
This advice works very well if you're recruiting participants, but if you're not, then it becomes a little bit more difficult to kind of include EDI.
Yeah, but there will always be people involved in your research, right? Even if you're working with molecules, stones, right? So who are your knowledge users? You know, who are the members of your team? Who are the people who will, eventually apply all the inventions that you're creating, and how you will make it more digestible to them. So how you're gonna facilitate appropriation, for them. So always think of the people, right? And how these people are different, diverse, are located in different social groups. And in that way, that can also become a source of innovation, other methods to transfer knowledge, other methods to even to conceive some questions. That's a way to integrate EDI in research. It's important. It's an important question because EDI can be integrated at different stages of research, the research project. It's not only the recruitment of participants, it can be also in the analysis of data. You can bring some people that might different perspectives that could enrich your analysis or knowledge translation or. Yeah, very good.
Yeah, thanks so much for the presentation. And during your presentation, you point out the importance of listening the community that you were serving. And you presented your background, and you point out that when you started your position in the RI, you were carrying all this background, or all this baggage, you know, and that baggage might make it difficult, the task of listening to a new community that has many different needs compared to the old community that you were serving. So what are the advice that you can give to be better at listening to the community and not let your baggage to maybe not listen what you should be listening?
Yeah, yeah, it's a great question. How to transfer the skills of that baggage into more kind of organizational work? Basically, that's your question. A great question. I think we should never forget who we are as researchers. I think, and thanks for this presentation helps me reflect on that, right? Like, we should never forget who we are, what we've learned through our own process, and how our own gaze has a value here. You know, I bring this on work with Indigenous people, victims of war, and women, and so on. But another EDI specialist who is more experienced in working with people with disabilities and so on will bring another element. But all of this has an important richness, right? So it's up to us to show the value of our methodologies, right? So I think, for instance, the fact that I've been able to lead focus groups and workshops with people in different languages, including the indigenous languages. Okay, that's something that has been very helpful in the consultation processes of the ADI action plan. Or the fact that community people always want like practical things that really work for their daily life. So that makes me think, okay, how can I make practical things for our researchers so they feel that this is not just a preach, right? So it's always trying to persist on what I've learned from my background, from my fieldwork, and also to think that research is always it's always relational, right? Your research results will depend a lot on the relationship you will establish with your research participants, with the people who listen to you, people who will give you feedback. So how you create those relationships in order to produce better science, better data, and some changes.
All right.
Question. So when we look people, so nowadays when we go and apply for some for CHR, we have to take a certification for including sex and gender. But yeah, sex and gender is usually just female males, women men. So we don't include the non-binary, the transgender, and all that. How should we address this in for example, our research proposal? Because I don't know if we are like in the example that you gave about the hospital, what was the orthopedist?
Yeah.
Because the orthopedist, so we know that hormones play a role in fractures and so on. So how do you include people who, for example, are reassigned as a woman or man? How does that play? So how do you include that, for example, in a population? Now the population is different, like maybe years ago it was not the same, it was black and white or female male, things like that, but now it's different. So improve in that area. Yeah,
it's a very important question, and I get that question a lot from our researchers. I think there are several elements to respond. First of all, we need a lot of precision in language. Okay, there's what I see in a lot of sex and gender analysis sections in our research proposals. It's a big confusion between what gender is and what sex is. Okay, gender is cultural, gender is roles, sex is completely physiological. You have three options. That's it. In gender, you have the complete rainbow, right? Second, who is relevant for your study, right? And why they are relevant for your study. So this is a great question. And you can say, okay, I'll focus mainly on male subjects, okay, sex, because this is the only there won't be change, and it's proven that there's no change and so on. However, you can enrich that as well through
Like, we also want to know what happens to the people who has changed sex.
yeah,
Because, I mean, this is going to be a different,
exactly.
it will be a completely different pathology, because these people who are born as a guy and then become a woman, then they will be exposed to different concentrations of hormones that might
Exactly.
implicate something different as they're in their physiology, their
Yeah,
pathology of diseases and so on. So we will have to include in the future.
exactly.
Because there will be no information about how certain things affect. It's like what happened with women many years ago. Like, they were doing research only in men, and then things that were working for men, they were toxic for women and things like that. So it might be a possibility that in the future, for these people who have been assigned sex, the difference will be what we saw with women years ago. So
Yeah, and this is a great the sex and gender analysis section is a great opportunity to explain why you want to include these trans people or non-binary people, right? And what's the role they're gonna play in your research. Something very important is that you should always get rid from the minority argument. Many times people say, ah, yeah, they just represent 1% of, for example, they just represent 0.3%. Yeah, but they are people anyway. They are living specific conditions that can be a great source of innovation if we understand what's happening with them, how hormonal treatments affect this specific disease that I'm studying. So by defining who your population is, how useful it is that they are there, and how this will enrich the understanding of your whole field of knowledge, I think you're going to have a case for your gender analysis. And also, I also believe that if you want to involve them, you need to show that you have consulted them, right? That you have some trans people in your team or have partnered with some trans organizations that helped you shape your research questions, right? Or that you validated your methodologies with them. Like, listen to the people, always bring them into the conversation.
how do you improve the engagement of your community? Because, like, you see, there's no much engagement every time that there is a ABI related activities. This is the amount of people that shows or.
I'm very happy because people are engaged, people are asking questions, we are trying to change a culture that is completely unfair, that is anchored in power relations, in historical power relations, right? Such as patriarchy, such as sexism, such as colonialism, and so on. So we are going counterculture somehow. And we need to create alliances. We need to be creative. We need to be persistent, but we also need to value our small achievements. So I think by adding efforts, we'll be able to strengthen our movement to change.
Good. Takes us to time. Thank you very much for your
Thank you so much.
contribution today. We're happy to have you. Thank you, the audience, and to those online for joining us and for participating. And we'll see you in a couple of weeks.
Thank you so much for the invitation. Thank you.